Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and today we'll be addressing a program you need to have in your portfolio to sell now, to revisit some of your book of business, using it as a marketing program moving forward, and it's a key component addressing specific needs during the annual election period. And of course, what we're visiting about are our partners at Ameritas. So keep in mind, today's presentation is being recorded, will be made available on our website and on our YouTube channel. And the software system does have a section for both questions and chat. Should you have some questions, pop them in there. We generally address them through the course of the presentation, but we want to make certain that we get you the detail you need to be comfortable with recognizing the value of these programs and offering them with consistency to your prospects and your clients. We'll start with a bit of level set about who Premier is. We are a national marketing organization, for those of you who don't know, founded in 1968. That's part of the Integrity Marketing Platform with offices across the country, licensed in all 50 states. We work as a wholesaler through independent insurance agents such as yourself, offering contracts to the highest possible commission levels with recruiting contracts available to those who qualify. We do so through that full portfolio of products that include the base Medicare programs, the Medicare Advantage, Medicare Supplement, standalone Part D prescription drug programs, but also a portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and the ancillary benefits, much as what we'll discuss today with dental, vision, hearing, critical illness, cancer plans, hospital indemnity programs, accident plans, and even a telehealth program. When we look at the Medicare Advantage portfolio, it has those national carriers there for you for your use through our organization, along with many of the strong regionals that can make a difference for you in your market. And that philosophy carries over to the prescription drug programs, where the national carriers are there for you, normally part of your contract with the Medicare Advantage carrier, but we want to make certain that you recognize that the Mutual of Omaha PDP program is a separate contract from any of their other products, and Clever RX is actually a discount program and not a certified sanctioned prescription drug program. Medicare supplements, a great market for dental, vision, hearing programs and other ancillary programs as well. We have a robust portfolio and specific marketing programs to help you be successful in this space as well, much as what we do when we speak of the ancillary products, where in each of the categories, the national leaders are there for your use. And we want to make certain that you can utilize these programs to fulfill those specific needs of your prospects and clients, have another way of marketing, and generate additional revenue for yourself and your agency. So when we look at the Medicare market overall, we talk about the aging of the baby boomers, the silver tsunami, one every 10 seconds. 10,000 plus a day, but we're seeing an increasing number of people who are turning 65 and are choosing to delay full access of their Medicare benefits for one reason or another. Maybe they're waiting for Social Security max amounts at 67. Maybe they're working past 65 because they can, because they want to, or because the pandemic has changed some different things for different people. However, this is a category that, regardless of their choices, since these are the programs we discussed today, fee-for-service programs that people can take regardless of whatever other coverage they have, it's still a good market for us. And that cutoff of some of that 63 million people on Medicare, while a good portion of them are under the age of 65, accessing Medicare because of disability, great market as well for the programs we discussed today, because the choices that people make when they come on Medicare, well, they're varied. They don't have to do anything. They can even decline Part B if they want to, self-insure for that, go the least expensive way. Thankfully, most folks don't least expensive way premium-wise, but some of them will take Part B and then look for Part D coverage to help with prescription drugs. Some will pick up the standardized, modernized Medigap policy and the Part D program. Great prospects for our programs today. And then some will go into the bundled benefits of Part C, the Medicare Advantage plans, or even if there are dental benefits, it may not be enough. So we want to make certain that whatever choice an individual takes, whatever avenue they go upon, well, we're taking care of them. because it's still a fairly even split as to what their initial choice is when they are coming into Medicare, and we want to be prepared for that. And part of that is translating the language that's part and parcel of any segment of our society with all the lovely acronyms. We actually have an acronym guide on cms.gov right now that helps us stay in tune with what those acronyms are. 4,420 of them in this particular screenshot. I've been in this business longer than I care to admit. This portion of it, there's always one that still pops up that you go, what is that? This gives us a great way of making certain that we're properly explaining the benefits and the programs that are in play. And it reminds us to limit our use of acronyms, or at least explain them so folks totally understand what we're talking about. Because the election periods, well, it's all alphabet soup. The SEPs are alphabet soup. The extra special SEPs, special election periods, there's an acronym, are soup. What's nice for the programs we discussed today, lock-in doesn't have a bearing upon whether or not we can offer these programs. So we need to make certain that it may be an opportunity for us to work backwards, where someone is interested in dental, vision, hearing coverage, and they open the door then for a special election period with their base coverages. So something to consider, because the majority of people on Medicare aren't reviewing their plans year over year and find out the hard way that they need additional coverage. And it really affects some of the particularly vulnerable. And we want to make certain that, they're not reviewing their coverages. How can we help them and make certain that they realize that we have information that can help them year round and augment the coverages that they need, because they're not accessing the information that's out there from the government, that's sent to them, available online, whatever it happens to be. They're not utilizing their review. It's the old cow path through the pasture. They're comfortable with it. All we need to do is pull out the Bible of sorts. And I missed updating the Medicare and You guide. But one of the most prominent things that show up on this, not covered by A and B, are dental programs, vision programs, hearing programs. So it's a hole in the coverages for everyone to one degree or another that we need to address, because, original Medicare, well, it does some certain things with it, but not a hell of a lot. And we want to make certain that we can help people with these expenses, because as we mentioned, the majority of them don't have it. And many of them that do visit the dentist are actually finding out there are other health concerns they need to address. And the reason they're not doing it, for the most part, is the cost. And we can address that. And what's nice is when we have partners that help us virtually as well, where the program and marketing support gives us the opportunity to do things virtually and translate that over to an in-person visit as well, and a combination of those to make certain that folks that are trained over the last couple of years understand how they can get this detail electronically, make it simple for them, utilizing some of the different tools that Ameritas makes available to us. And it gives us the opportunity then to really manage our time as well, which is a great concern for us all. It also gives us the opportunity to put additional product in the house and bump that retention of the different programs you have in play. Keep in mind, the more product you have in the house, the better your retention, the higher your persistency. And it doesn't matter if it's with the same company, it just happens to be with the same individual agent, which is you. This is a great partner program for folks offering the base coverages. So as we talk about the program to sell now and during AEP, we've invited our good friend Taylor Davis with Ameritas to come on and visit with us about the programs and some of the marketing pieces that come into play and can make a big difference for us. So at this time, I'm going to turn control over to Mr. Davis. And say, hey, Taylor, you got the helm.
Awesome. Thank you, John. I appreciate it. Such good information that you have at the beginning of these webinars. I appreciate you getting everyone up to date, and I enjoy listening to you talk through all that information. And also thanks everyone for joining. I know you have a busy schedule and hope to make take the next 25, 30 minutes to tell you a little bit more about Ameritas, how we stand out from the crowd, through no waiting periods, next day effective dates, largest network in the industry, ease of enrollment, all that great stuff. But I'm also going to be doing a little bit of something different at the end. I'm actually going to show you our enrollment process. If you're not aware, here at Ameritas, once you do get contracted with us, you receive a personalized hyperlink. That hyperlink is tied to you. That's how you quote, and that's how you enroll. I'm going to show you how that process works. And also I'm going to run through our marketing website. And also at the end, I'm happy to say that we just launched a new producer portal about 3-4 weeks ago. So if you do have a book of business with us, if you do write business with us, now you can go into that producer portal. You can search your book of business. You can search lapses. You can search retention. You can search all that kind of stuff now on our new producer portal. As everyone knows, dental and vision has become a pretty hot topic in the conversation today around Medicare and even ACA as well. Our products are 18 and older. John's already alluded to a lot of this information already, so I don't want to spend a ton of time on this slide. But the demand for dental and vision is huge. The referrals, especially for a product like Ameritas Dental and Vision with the no waiting periods, large network, great negotiated rates, clients are going to be using the product and they're going to be talking about the product. I have a great one-piece flyer that goes over hypothetically how our product works. As John also talked about, persistency, right? The more products you have with that client, the better persistency you're going to have with them. Adding value to your clients' lives. That's our goal here at Ameritas, is adding value as soon as possible. That's why we have those no waiting periods, next day effective date. You can be talking to your client today. Tomorrow they can go in and get implants, dentures, crowns, bridges. All of that stuff is covered day one. And we want to grow your reputation. We want to grow your business, and we want to grow your commissions. So here at Ameritas, how do we stand out from the crowd? Well, first off, Ameritas is a dental and vision focused company. It's kind of unheard of in the marketplace today, but we don't have a Medicare product, a MedSup, Medicare Advantage. We do have a life division. We have a 401k division, but about 85-90% of our business here at Ameritas is dental and vision. So there's a lot of expertise surrounding just those two products. And we focus on three things when we do launch new products. Like the three I'm going to be going over today, we launched middle of last year. We look at enhancements. We hear from the field. We hear from consumers on what they want to see in a product. One of those things is product simplicity. Clients, agents, they don't want to spend 15 minutes, 20 minutes just going over products, right? We want the best products out there, and we want to give it to you in a way that is easy to understand. We all know going from group to individual can sometimes muddy the waters a little bit on anything, but we want to try to mirror that group side as much as possible. So we do have those no waiting periods. We have that day one coverage, and yes, that's including implants. We have that next day coverage. And we really want to focus on that member value and that member flexibility. Member flexibility when it comes to dental is you can go in or out of network. Yes, it's fantastic for the client to go in network with those negotiated rates. We're anywhere from 25 to 50%. But we understand we don't have 100% of the providers out there. So you have that member flexibility of going out of network as well. Our network utilization on our book of business is 77%. So 77% of clients are going in network. It's a large number. Policyholders just last year, by just going in network, saved $26 million. So it is a great conversation to have with your client on network and the benefits of going in network. But again, we want that member flexibility. They can go out of network as well. Our plans are available 18 and older with no max age. Last and certainly not least is that enrollment process. When you look at products like dental and vision, you want that enrollment process to be seamless. One, you don't want a paper application. You don't want really an e-app, a back office e-app to have to go in, log in, need e-signature, need social security, all that information. We make it as simple as possible. So as I mentioned before, once you do get contracted with us, or you possibly could be contracted with us already, you have a personalized hyperlink. That is tied to you. That's how we track your business. That's how we pay your commissions. It's off of that personalized hyperlink. There's no back office login. Again, we don't ask for social security number. We take credit card. We take EFT. Also, with regards to that enrollment process, you can put it on your social media. You can send it out via email to your clients who you haven't spoken about dental and vision to. There's just a ton of different avenues you can go down with how our enrollment process works today, which I'm going to be going over here in just a little bit. So talking about products, we are in all 50 states. Again, with that personalized hyperlink that you get when you're contracted with us, it'll automatically pull up that product in that specific state. So if you do write in Washington, where it is a state-specific plan, that product will automatically pop up on your enrollment tool once you type in a Washington zip code. We are zip code rated. We're not age rated. So we have 7 area factors. The rate does not increase due to age. Okay, so if someone's 18 years old and someone's 100 years old, they're going to have the same rate if they're in the same zip code. As I mentioned before, we are in all 50 states. We do have some state specifics. Illinois, New York, and Connecticut, very slight state specific. Same thing with Mississippi, Louisiana, New Mexico, and Georgia, Montana as well. Washington is the biggest state specific that we have. I know everyone on this call has been in the industry long enough to know that Washington likes to make things a little different. So if you do sell in Washington, reach out to myself or John, and we'll send you over the product specifics for that state. Really, Washington's the big outlier when you're looking at all 50 states. So as I mentioned before, the 3 products that we launched last year are PrimeStar Total, PrimeStar Access, and PrimeStar Value. Now, as I go through these products, you'll kind of see that maybe they're geared towards a specific demographic. With PrimeStar Total, it might be more geared towards that senior population. There's a hearing benefit in there, higher maximum benefit as well. As I go through PrimeStar Access, maybe more geared towards that younger population, because there's LASIK, there's teeth whitening, there's child ortho. And then there's a value plan that's more for the budget conscious individual who's looking for a product that's in that $20, $22 range. So starting off with PrimeStar Total, Dental Max benefit per year starts off at $2,000 day 1, jumps up to $2,500 in year 2. We also have a cool new feature called Preventive Plus. What Preventive Plus means is preventive services do not go towards the max benefit. So preventive is covered at 100% day 1. Someone goes in tomorrow and gets a cleaning. That cleaning, let's say, costs $120. Well, we're going to pay 100% of that $120, but that $120 does not go towards that $2,000 max benefit. It's a really cool, unique feature. Our deductible, $0 for preventive, $50 for basic and major. As I mentioned before, preventive is covered at 100% day 1. Basics covered at 80% day 1, jumps up to 90% in year 2. Majors covered at 20% day 1, jumps up to 50% in year 2. We also have an annual hearing exam benefit on this product. It's not a rider. It's automatically built into the PrimeStar Total plan, and that's $75 for a hearing exam. Hearing aid benefit per ear, $200 day 1, $300 in year 2, $400 in year 3. So as I mentioned before, this might be more geared towards that senior population, but this product is 18 and older with no max age. PrimeStar Access, as I mentioned before, may be more geared towards the younger population, but again, someone 120 years old can have this product as well. Dental Max starts off at $1,000 day 1, jumps up to $2,000 in year 2. Same feature as PrimeStar Total. Preventive Plus is included. Again, preventive services do not go towards the max benefit. Deductible, $0 for preventive, $50 for basic and major. As you can already tell by going through this, the first thing I said is product simplicity. We've mirrored as much as we can through products, but give the product a little bit of a difference for that specific client. Preventive services covered at 100% as well, day 1. You will see with PrimeStar Access, if a client does go out of network, the co-insurances do change. PrimeStar Total, the co-insurances do not change if they go out of network. That's only with PrimeStar Access. Basic is covered at 65% day 1, jumps up to 80% in year 2. Majors covered at 20% day 1, jumps up to 50% in year 2. Another difference between PrimeStar Total and PrimeStar Access is there is teeth whitening under the major category when it comes to PrimeStar Access. Also, child ortho under age 19 starts off at 15% day one, jumps to 50% in year two. Lifetime max per person is $1,000. That $1,000 does not go towards the dental max benefit there at the top. LASIK, $125 years 1 and 2, and that's per eye. $250 years 2 plus. So with LASIK, it's something very different on a dental product. But again, these are not riders. These are automatically built into the plan. So with PrimeStar Total, you get the hearing benefit, you get a little bit higher max benefits. With PrimeStar Access, you get the LASIK, teeth whitening, child ortho, all those features in this plan alone. Again, this is 18 and older as well. PrimeStar Value. PrimeStar values for that consumer whose budget is in that $20, $22 range. Dental max benefit is $750. We do have Preventive Plus on this product as well. Deductible, $0 for preventive, $50 for basic and major. Preventive services are covered at 90% day one, 100% in year two. Basic, 50% day one, 80% in year two. Majors covered at 15% in year two. So we have a product that really fits every consumer's needs. If a consumer's reaching out saying, hey, I would really love a higher maximum, and also I would love to have a hearing benefit on my product, well, then PrimeStar Total would be the route to go. Access, if the client says, teeth whitening, LASIK, child ortho, that's right up my alley. I love to have PrimeStar Access. PrimeStar Value, my budget's in that $20 range. It's a great product for them. So as I mentioned before on our marketing website, this is my favorite piece, and I'll show you where to access it here in just a little bit. But this shows you how our product works. For time purposes, let's focus on the purple column. Purple column is the major category. So what I did here is I typed in a zip code in Minnesota. And in this zip code, I said, what's the average cost of a crown filling and a preventive visit? So again, the crown is a major in that purple column. The average for a crown in this specific zip code is close to $1,400. So if no one has insurance and they go in to the doctor, on average in this specific zip code, they're going to be paying around $1,400. Now, let's say the consumer purchased PrimeStar Total, and they go to the dentist tomorrow and they need a crown, and it's in network. So that $1,400 is the average. So realistically, our average on negotiated rates is about 30%, 31%. So without even talking about the product itself, that client is saving an average of 30% by just going in network. So take that 1,400 times 30, 31%, comes to 803. So again, without even talking about the co-insurance, without even talking about the no waiting periods on major, you're saving that client close to $600 by just going in network. Now, again, we want that member flexibility of a client. If they have to go out of network, great. They just don't get the benefit of the negotiated rate, which is that 803. So 803 times 20%, right? Because we covered 20% day one for major. That's a 53% savings. Back to that first slide that I was talking about that John spoke to already about referrals. If a client goes in and says 53%, if you're talking to a client today, they go in tomorrow and they say 53%, you betcha they're going to be talking about it, right? Whatever product that is, whatever, we're talking about dental and vision right now, but they go in and you save them 53% on something they thought they were going to be spending $1,400 on. That's a great story. That referral base will grow. They'll talk to their friends, their family, their neighbors, whoever it might be. I would, right? If I was thinking about having to spend $1,400 and then all of a sudden I talk to Mr. and Mrs. Agent and they give me, they sign me up on this Ameritas dental plan, and all of a sudden I go as soon as tomorrow for major and save that amount of money, that's a great story. Now, as I mentioned before, we want to provide value to the client. We provide it day one and also in year two. So say that client doesn't go get a crown until year two. Year two, we cover it 50%. So take 803 times 50%, 402. So whichever way you look at it, you're providing that value, whether that's tomorrow, 12 months down the road, you're providing that value for the client. On the vision side here at Ameritas, we offer both IMED and VSP. So the same thing that we had with dental with that member flexibility by going in or out of network, at that point of enrollment, that client has the member flexibility of choosing IMED or VSP. Really what vision boils down to is one, where's the client used to going? Are they used to going to Costco, VisionWorks, Sam's Club, Walmart? What's their budget? Is their budget $10? Is it $16? And benefit frequency. Do they need eyeglass lenses and frames once every year? Or do they just need them once every 2 years? That's really what the three things boil down to when you're talking to your client about vision. So IMED is our select vision. You're looking at like Lens Crafters, Pearl Vision, Target Optical as network retailers. Select Vision is just over $10.50. You'll see Florida, Minnesota, Mississippi rates as well. But this is our low cost plan. It's a little bit less than our VSP plan. But when you pay less, your benefit frequencies are going to be a little bit different, right? So an exam, of course, is once every year. Eyeglass lenses, contacts, and frames is once every 2 years. Deductible is $25 for the exam, $25 per person on the deductible for eyeglass lenses. You'll also see that we do have frame and contact allowance of $130. Switching gears to VSP, it's our Choice Vision product. You're looking at Costco, Walmart, Sam's Club, great name recognition when you're talking about VSP. But again, where is your client used to going? VSP is just over $16. You'll see Florida, Minnesota, Mississippi rates over there to the right as well. Again, a little bit more expensive, but the benefit frequencies are more frequent. 12 months for an exam, and also once every year for eyeglass lenses, contacts, and frames. Also a little bit more expensive. That deductible is going to be a little lower at $10, and a little bit lower also for those eyeglass lenses at $20. Allowance is a little bit more than IMED. IMED was $130, VSP $150. So again, those three things, right? What's their budget, benefit frequencies, and where are they used to going is really what is going to help that client decide on what vision product they need. Making it easy to work together. As I mentioned before, and I'll give you the website here in just a little bit, the producer portal, great for agent tools, right? You can go in there, see your book of business, see lapses, see persistency, all that information on there. You can see who enrolled through your hyperlink, all that great information. But these agent tools right here is our marketing microsite, the same place where you can find that flyer that I went over with hypothetically what the costs are for major, basic, and preventive services. And we actually have it for each of our products. So PrimeStar Total, PrimeStar Access, and PrimeStar Value, we have it illustrated for that flyer I went over. Also find brochures. You'll find social media posts, blog articles, and also don't forget with your personalized hyperlink, you can put that up on your social media. You can send it via email. I mean, that's a tool within itself, right? If you don't offer dental and vision a lot, or you're tired of logging into a back office, or if you have a paper application, you can just send this link off to anyone and they can enroll themselves. Again, we don't ask for an e-signature. We don't ask for a social security number. They can have credit card or EFT. Very, very simple process. But also take a look at our microsite. It's a great social post too, as well of kind of going in depth of why Ameritas, why our product, network information, a lot of great information on the microsite. And again, that's explore.ameritas.com/agent marketing. Explore.ameritas.com/agent marketing will take you directly to that page. I've already mentioned it a few times on here, but your hyperlink, remember, if you're contracted with us, you have a personalized hyperlink. That's how you quote and enroll. I'm going to show you just here in a little bit how easy the quoting process is. So I'm going to zoom through here. Find a provider. I'm also going to show you where to access our provider search from. If your client is looking at what providers are nearby via zip code, you can look at a 5-mile radius up to like a 120 or 200-mile radius as well. Great information here. If your client says, I don't care where I go, I want to be in the Ameritas network. Well, you can help them search for providers nearby, or they can search themselves as well. I'll go through all that here in just a little bit. Producer portal, as I mentioned before, we launched this about 4 weeks ago. Producerportal.ameritas.com. You can now access your book of business on that producer portal. So log in, register, and really check it out. And if you have feedback for us, send it to us. We'd love to hear what you'd like to see. We're going to continue to enhance our producer portal, and the best feedback is from you guys. What you want to see on the producer portal changes, or if you love it, let us know as well. We'd love to hear that. So let me switch gears. I'm going to go to let's start off at the personalized hyperlink. So again, once you get contracted with us, your hyperlink page will look exactly like our homepage. So our homepage is myplan.ameritas.com. What'll be different with your URL? It'll be myplan.ameritas.com. It'll have it'll say ID / and it'll have your agent ID at the end of it. But it looks completely the same. So every once in a while, click up here in the top right-hand corner, and that's the agent tab. Your information will be here. Right now, it's our Sales Connect team's information because this is our main website. But once it is your personalized hyperlink that you're on, this will have all your information, your phone number, your email address, all that great information. As I mentioned before, we are zip code rated. So all you got to do to get started is just type in whatever zip code your client's in, or type in a zip code that you rarely sell in as well. What's going to pop up first is, do you need dental coverage? Yes. Do you need vision coverage? Yes. How many need coverage? Dependents as well. So what's going to pop up are the 3 dental plans. Again, if you do a state specific, it'll automatically pop up those plans. But what'll pop up is value, access, and total. A great resource for your hyperlink as well. Instead of carrying around brochures or emailing brochures, you can view plan details. Pretty much exactly what I just went over on this PowerPoint is right here under view plan details. Tells you what's covered, talks about preventive plus, talks about day 1 coverage, year 2 coverage. You can do the same for the total as well. Something you can do is compare. So if you want to compare the access and the total with your client, you can hit compare, and you compare the two, right? One has LASIK, one doesn't. One has teeth whitening, one doesn't. You can compare them right then with your client. So let's just do PrimeStar value. And what's going to pop up next are 2 vision plans. So you got Select Vision, which is our iMed plan, and Choice Vision, which is VSP. Same thing here. You can view plan details. You can compare the plans. Let's select iMed. So you're going to review. You purchased the Select Vision and also the value plan. Total monthly cost with the 2. And again, both are standalone plans. So if a client just needs vision, they can just have vision. If a client just needs dental, they can just purchase dental as a standalone plan as well. So let's enroll now. As I mentioned before, effective date as soon as tomorrow, or you can go 90 days out. So let's just go as soon as tomorrow. They don't have to have an email address. Where the email address comes in handy is if they want to receive their ID cards electronically. There's a point at the end of this enrollment process that there's a button you can click to say, send my ID cards electronically or send them via mail. We've seen an uptick in clients wanting to receive them via email. But again, if they like the card in their hands, we can send them via mail as well. And it's about 7 to 10 business days to get them in the mail. You can also continue without an email. So let's just go ahead and do that. Name, gender, go through here. Again, very simple, really depends on how fast you can type. Put in the information, go to continue. Dependents, we didn't do any dependents, so go to the next. Previous insurance, we're just gonna say no, continue. You're gonna review the 2 plans that we just looked at, PrimeStar value for the dental, Select Vision for the vision plan, monthly cost again, you'll see the coverage, you'll see the coverage effective date, hit continue. And then you'll have the payment information. billing address. You can do credit card or EFT. Very, very simple. I can't continue because I'm not going to put any information on here. But once you hit continue, it'll be agreement, say agree, and then that's it. Again, there's no e-signature. There's no back office login. We don't ask for a social security number, right? They can enroll themselves. It's a very, very simple process. So again, your hyperlink will look identical to this. Just up in this top right-hand corner, it'll have your information. So if every so often, just go ahead and click that and make sure it's your information, that you're on the right hyperlink. So again, easy as that when it comes to the enrollment process. Agent resources, this is the microsite I was talking about. You can find all the brochures on here. We have flyers, we have Spanish brochures, product information, sales tips, podcasts, and also share with clients. This is where you can find those flyers that I went over with a hypothetical illustration. You can find them under Make a Sale, Best Economic Value Consumer Brochure. That's where you can find exactly what I was just going over with that total. With going in network, you save this amount, and then also with the day one coverage on co-insurance as well. So that's where you can find all that information. Email templates, if you're looking to send an email about Ameritas with your hyperlink, you can take one of our email templates. Social media posts as well. If you do follow me on LinkedIn, our marketing team does a great job on posting on the LinkedIn as well, and I like to share those just because that shows you what you can use to reach your clients with the dental and vision products. Here's the Find a Provider tool. You can find the provider tool on your hyperlink up in the top corner. It says Find a Provider. You can go that route, or you can just type in dentalnetwork.ameritas.com, and this will take you directly to our provider search. So I'm just going to type in a zip code real quick. On the selected network, you're going to do classic PPO. You have additional filters. So this is where you can search a provider name. You can do distance, all sorts of information on the additional filters. What's the search? So these are all of the in-network providers. This is just a zip code here in Oklahoma City. And what's the difference between the providers displayed in green and the providers displayed in black lettering? All that means is the providers in green, we want to say thank you for going above and beyond. They have an above average negotiated rate. So if a client says, you know, I don't care where I go, I just want to be in the Ameritas network. Well, as an agent, I would choose one of the ones in green because they have the best value. They have the highest negotiated rate. But by no means am I saying the ones in black lettering do not have great negotiated rates. They absolutely do. Anywhere from 25 to 50%. If they're in our network, they have great negotiated rates. So that's just a quick way to go on there and search for providers in a specific zip code, county, state. There's a lot of different ways that you can search for them. So as I mentioned, go to the producer portal, take a look at it. You can see your book of business now on the producer portal, and that's producerportal.ameritas.com. And yeah, super excited about that information. So next steps, if you're not contracted with us through Premier, get contracted, get your hyperlink, start selling the dental and vision products. Be on the lookout here before AEP and open enrollment. We got some cool new features coming out with our products that are very exciting. I know we're going to have another webinar at the beginning of September that I'll be able to kind of talk more about some of those features. But just know there's some really unique features that are be coming out before open enrollment AEP that'll help you market our products even more. So John, I'll pass it back over to you, and if there are any questions, I'd answer them, but I know you have some information to go over as well.
Thanks, Taylor. I really appreciate you lending the agent perspective to this piece, and I want to, one, congratulate Ameritas. Notice I'm using the American pronunciation of Ameritas as opposed to my Ameritas. Sorry, I had to throw that out there.
You're good. You're good.
All the time. But one of the things we hear a lot from agents is how can we help with social media? You guys do a phenomenal job with that. And when you have the microsite URL there where folks can say, hey, need dental coverage? Don't want to talk to an agent? Come here and shop. I mean, it's a great way to, push business through social media. And then you have all the other templates that come into play. That's awesome. And I congratulate you and your organization on that. The web addresses that Michael is asking for, we've provided and you went back over, but we want to make certain that we get those out so they're easy to find because you have a number of them. The other question, however, is a different Michael asking, are credit card payments the same as EFT?
Yeah, they're the same. Yeah, we don't charge more for credit card payments.
There you go. There you are. So as I assume control once again, thank you again, Taylor. Some of the things that we want to make certain that folks on the webinar or listening to this later know is, why do you want to do this through Premier? Well, we have a way for you to create your agent profile within Insurance Bay to do electronic contracting with a number of organizations. With Ameritas, we're going to send you a specific link to speed up the process and make certain that we follow through all their detail on getting folks contracted. Simple, quick process, but we want to make certain that folks are aware of that. We do offer discounted D&O for qualified agents. What makes you qualified for errors and admissions coverage at a discount? Well, you got a contract with us. But what this is not adding you to a blanket E&O policy for just one program and you got to worry about everything else. This is a program you own, and it covers you for that requirement that just about every insurance company has on the books now, where you have to have your own version of malpractice insurance. It covers you regardless of the programs that are listed here and regardless of who you're contracting through. We realize we have a broad portfolio of programs. We don't have everything. No one does. It's a great way to make certain that you protect yourself across the board. We do also offer discounted continuing education programs through our affiliation with WebCE. And you have a way of adding to your own benefit package as an independent agent. That's your responsibility. But we have a modified guarantee issue disability income program where you're paid on a commission on a program you're taking out on yourself. Much as where today's presentation is being recorded and is available on our website and on our YouTube channel, past presentations are as well. A great way for you to incorporate some of the information we received today into perhaps community presentations, re-reviewing some of the things that, oh, what did Taylor say here? You can go and check that sort of thing. So it's all available to you online as well. We do, of course, offer complimentary access to Medicare Center to our contracted agents. Sorry, I'm a longtime Medicare Advantage agent. I still have a hard time saying free on stuff, but this is free. And it offers you a single login, a 3 quoting engine, and other tools made available where you can do side-by-side comparisons of base Medicare programs, but also ancillary programs. So you have the different tools in here to help you sell, and the CSG program that's part of this system gives you an access to quoting data for Ameritas and their programs through this system as well. So a great way to add on another way to electronically reach out and touch folks without cost, because you can fill in gaps utilizing the tools here. And it, for many people, it's part of their standard presentation now moving forward, since dental, vision, and hearing programs are such a demand product. We do also offer a page on our website that gives you the information on carrier incentives, those extras that are available through the carriers in certain circumstances, maybe help qualify for carrier trips and our own incentive programs that can help you. Some of the different marketing support. Well, one of the things you can do is smile and dial for dental programs. If you're like me, I think I took about 30 calls, well, had 30 calls come through with different people offering me different things. A lot of them out of boiler rooms. This, however, is a differentiating program where you're able then to speak to people about dental coverage, something they want. And it gives you the opportunity to fill your pipeline for the Medicare season, since Taylor did mention, and I had neglected to, the fact that these programs are available to the under 65 population, clear down to 18, but you can then target the 63, 64-year-olds for additional dental coverage. Put them in your pipeline, have them in your book of business, and grow your own T65 list in that circumstance. It's also a program that's listed on the scope of appointment that you have to do when you work retail as well. Now, you're not necessarily presenting this program in a retail setting. You're not presenting a whole bunch of programs in a retail setting. You're looking for leads there, but it is a topic that can help you when you address other centers of influence in the community, such as faith-based organizations, or work with dentists to help them recover as much revenue as possible through the offering of dental programs. Many carriers do offer generated prospects that they share with agents that are a quid pro quo situation. You scratch my back, I'm going to scratch yours. Not out to you there, Faith. It gives you then the opportunity to access another way of filling the pipeline in a manner of speaking. We do have internet social leads, or internet social media leads as well, a program for that, a direct mail support program, as I referenced, a T65 locator. That's an awesome thing if you are a door knocker, which you can door knock for dental programs, and a reminder program on how to work referrals that gives you the access of growing one lead into multiples. A great way to do it. And Mr. Streets, we will get you the information on the average savings based on zip codes as well. All part of that website information we need to get to you. The mail program, well, it's a discount program based on production. You got two ways of qualifying for it: through health programs, which dental programs do count, and through final expense. And we work through vetted lead vendors to make certain that we're keeping you in compliance with some of the letters that go out, but also to make certain that these vendors have systems in place that can get you out and in touch with mail responses as quickly as possible, as hot as possible as a prospect as you can be. We do also offer a program through one of our partners for just mail response, where you can purchase different respondents to direct mail, buy them on a one-off. You can use this as part of your marketing program to fill in holes in your calendar, whatever. Keep in mind, these costs do vary from area to area and time of year according to supply and demand. I've seen them much lower than these. I haven't seen them any higher than this. So we're talking mostly about the top ceiling as to what these would cost you. The internet leads are through Facebook, a program in play for final expense and Medicare as well. Once again, it's like the mail responses. The costs can vary according to area and the product. That T65 locator, this is a piece that is free. Boy, it was a struggle to say that. But you download it to your smartphone, you register on it, they check and see if you got a contract with us, and it's available to you. And if you're between appointments, gee, it'll peg out people where they live by age so you can market appropriately and compliantly. Keep in mind, don't door knock for MA or PDP. That's a good way to have the hatchet fall, but you can for MedSup, you can for dental, you can for final expense. So a great way of incorporating in additional programs in another way of filling the calendar. That referral program, well, one of the things that I saw in an article I read recently, only 11% of agents asked for a referral. So what's the big idea of how you generate success with referrals? You ask. You don't get kissed if you don't ask, so to speak. So the whole Pepe Le Pew politically incorrect cartoon now, I still like him personally. A great way of doing it. And it's a kind of a talking points to help you before the appointment's set, during the appointment, and thereafter as well, so you can work your book of business as well. So all that said and done, we speak to all this because we want your business. We want to be referable to you. The folks in home office are incredible with support, know what they're talking about, and it's a great way to get all the detail that is necessary with whatever insurance program comes to play. But Ameritas, with all their, there it is, Ameritas, pardon me, a great way of making certain that you're getting full benefit out of your relationship that you share with us, because this is a great component for your personal marketing plan now and moving forward. We have a webinar later this week on AEP planning. It's one of the points we bring up there. Put it in play. It's the old John Wayne and the Cowboys. Slap a piece of bacon in that biscuit, saddle up, let's ride, because we are burning daylight. You can do this now. A lot of talk about 2023 certifications. If we're talking about where we are now, we've still got 6 effective dates for regular MA business before we go to 2023. This helps get us in front of people to sell multiple programs. So all that said and done, I'm going to check for questions to see that we covered everything that popped up. Yes, I believe we have. At this point in time, for those of you that have done business with us in the past at Premier Marketing, I thank you for that business. I sincerely do. For those of you that are considering us, I thank you for that possibility. And I thank you for coming on the line and visiting with us today, soaking up this great information that Taylor's provided to us and for us. And I appreciate that investment of your time, because that's your most valuable resource. So you can reach us at 1-800-365-8208. If you're working with an agent success manager or marketer with our organization, they'll have this detail and they'll be able to help you with Ameritas and the programs that they offer. If you haven't a relationship with us, call that number. We'll make certain that you're assigned to a subject matter expert to help you and get you underway with these programs that can really make a difference for you with what you're doing moving forward. And that's very, very important for us all. So until we are able to visit again in the very near future, I want to thank you once again for your time and wish you good selling. Thanks so much. We'll talk to you soon.